Okay, great. This talk was supposed to be just on lower eyelids, but I think it's worth talking a little bit about more the whole concept of volume, including the lower eyelids. So I'm going to give you sort of a broader picture. Before we can actually inject volume, we have to understand what volume is and how that affects facial aging. So the fundamental question is, what defines a youthful face? Oftentimes we're sort of off the beaten track because the things that are obvious to us may not be so obvious in reality. When you look at Sharon Stone from the 20s to the 40s, the obvious answer is that her brows are sagging, her eyelid skin is sagging, her cheeks are hanging, she's got deeper nasolabial folds, she's got mini jowls, but actually everything, if you look carefully, is incorrect. If you look at her brow position, it's about the same height. Her eyelid position, upper eyelid position, really doesn't show much dermatochalasis, it's about the same height. So what is the aging there? It's almost entirely loss of fat. It's just that fullness that was there in youth. And you can see the bone coming through in the cheeks, and the chin area is hollow, the buccal area is hollow. And the nasolabial folds in this circumstance is not that much worse. If you look at this, look at Mandy Moore, she's got a very full, low brow. It's attractive. If you go start looking at some textbooks I recommend, they're known as Glamour, Allure, and Vogue, and then you can start seeing what actually young women look like instead of our preconceived notion of youth. Obviously, this is an extreme. Conservative brow lifts are great, but this is a very, very high arch brow with skin and fat removed. And the face just looks even more skeletal, and I think it can even advance aging. So we have a certain vocabulary list of aging, which include wrinkles, gravity, and volume. What we want to really focus today is on that latter category, which is volume. So there's an idea in Malcolm Gladwell's book, Blink, which is the idea that when you look at me and I look at you, we judge each other in a blink of an eye. And so what is really the fundamental thing that gives away aging more than anything else? It's shape. So what does that mean? Let's take a look at the evolution of shape to understand youth. A child is a circle, a lot of baby fat. As we proceed forward, teenage years, it's still a circle. So we're using fundamental geometry to understand this. Early 20s, still a circle. And then as we get transitioning forward, mid-20s, we start to have a little bit of that heart-shaped triangle come through, but still a lot of baby fat. As we get into the late 20s, there's more dominance of a triangle, and there's a little bit of still that fullness there. What's very interesting is a lot of women actually prefer their face a little bit more sculpted around their early 30s, and a lot of men actually prefer it a little bit rounder and fuller in terms of aesthetic taste in the mid-20s. So this is just a difference in genetic, or gender, I should say, perspectives. As we get older, into the late 30s and early 40s, there's a flattening effect of the upper face, and the lower face starts to dominate, and we get more of a squaring effect of the face, which is more masculine. As our metabolism slows down, and there's some facial descent issues as well, there's a lower face that begins to dominate, and it starts to invert the triangle. As we advance further into age, we really have significant periorbital hollow. So reductive periorbital surgery may not be the best answer in many circumstances. So what our goal is actually is to try to get the attention back up to the upper face. So if you understand sort of the fundamentals, you can then approach the technique. But I think we're remiss if we start talking about technique and we can't see first. My gold standard is the fat transfer. And this lady here had a very conservative upper bleph, plasma skin resurfacing, and she had facial fat transfer. There's no lower blephs or facelift in this circumstance. She's about 49. Here's a lady that had facial fat transfer alone, and you can see it actually, what's really amazing, we talk about the stem cell change, and this is 2 years later with no makeup on the right, and there's a significant improvement in the texture and tone of the skin. Not all the acne scar is gone. I apologize for, the camera actually picks up a significant amount of light on the after photographs. In this photograph, you can really see on the left, it looks like it's a hanging eye, but it's really a very open eye. It's a vacuous eye. And if you frame it down, it creates a significant improvement. This is about 1.5 years out from a single treatment. So the fat really does hold. We're going to talk today about off-label indications, because we're going to talk about hyaluronic acid, but specifically for uses that are not approved through the FDA, that is nasolabial grooves. So the thing what do I do? There's two major products, as you know, right now. There's many on the market coming right now, but Restylane and Juvederm. And actually, I was talking to Dr. Lambros earlier, and a lot of my experienced colleagues had significant problems with Juvederm around the eyes, with it swelling and migrating and things like that. I didn't do that many, but I didn't really see that issue. And the main thing to understand is it's just so much easier for me to streamline my inventory. So I basically use Restylane Perlane. I don't take any money from the company, but it's just really helpful for me to that as my principal HA product. And because I convert a lot of patients over to fat transfer, it's just so much easier to actually use the hyaluronidase and move them over to a permanent filler. In a moment, I'm going to have this video of sort of seeing the aging face, and it sounds like I'm on crack, so I apologize. I'm not on crack. It's coming up. So this is all in your handout. You don't have to furiously write this down. The idea is, how much do I put in? On average, I'm putting about 4 cc's of hyaluronic acid into a face. And I'm focusing on what I call the sort of prime targets, the areas that are very, very important to hit. The prejowl sulcus, or the anterior chin, and I usually would use about a half a cc per side of Restylane. The anterior cheeks, specifically focusing on the anterior malar depression. The inferior orbital rim, and I usually about a cc of Restylane a side, and that's quite a bit. And if it's younger, I'll just target the tear trough with about a half a cc aside. So usually 4 syringes, but I sometimes add a little bit more, and I'll show you some case studies of the judgment here. So the next most important area, or sometimes even the most important area, is the buccal area, and that can be significantly important in someone that's very gaunt or thin. We're going to show you that through a video. The nasolabial folds, I think, are way overfilled. I'm going to show you some examples of where my judgment actually dictates to fill it, and I'm also going to show you when I don't and why. Wrinkles and lips, obviously, are the things that most women come to you for, because a lot of times women are very focused in a very close-up, micromanaging way with their face because they put makeup on. So you want to take that female patient and move them over to the big picture, which is just looking at that wow effect, that blink effect.
The reason for the flightless on those, we're going to do some silicone correction for previous rhinoplasty. Of note, this nice lady already went through Vitra. She had a Tyndall effect going on over here. We dissolved a couple weeks ago. There was some Tyndall effects on the nose. So she shouldn't see any Tyndall effects with this technique. What I want to show you is some of the strategies of looking at an aging face and what we're going to do. You know, we're very focused on wrinkles and gravity, but really what it is bone exposure and hollowness. So we're going to fill in under the eyes with the Restylane, which is why I'm teaching this for Los Angeles, but we're going to focus on other areas that are very important as adjuncts. You know, when you see that, if I can just get a little volume here, it just makes the face look so much more youthful and feminine. This is the technique I do to show someone what someone can look like when I fill the cheek. It actually makes the eyes look so much more awake. Since I can't cover the bone, because the fillers are so expensive as it is to fill, I'm trying to maximize my fill, so I'm not going to cover the bone. Instead, what I'm going to do is cover around the bone. So that means the anterior cheek. And if you see, once I fill this, you don't see the bone. And that's what's so great about this, is I don't actually have to fill the bone, I just have to fill in front of the bone. So the transition zone between bone to non-bone disappears. The buccal area is so underrepresented, and I will tell you the thing that I see today is understanding that we always talk about mid-face enhancement, upper face enhancement, and lower face enhancement. What we don't talk about is the juncture between the mid and lower face. So this buccal area, in my opinion, is one of the most critical areas that we work on today. So we're going to do some Restylane in this area. And then the other thing is what I start to look at today is what's called an upside-down U. I don't just see this area as a jowl and a little bit of a labial mandibular fold. What I see instead is an isolated bone island with this upside-down U of hollowness. So we're going to really target a little bit of the pre-jowl area as well as into the anterior chin. Really not the line and really not the jowl itself, but this zone here that will create continuity between the bone island and the surrounding areas. We're going to do 1 syringe of Restylane here, 1 syringe of Restylane here, all done with a cannula injection, and then we're going to do a half a syringe of Restylane, half a syringe of Restylane, half, and half, and that's going to total 3 syringes of Restylane, 2 syringes of Restylane. I'm going to walk you through how to do this.
This is how I do it, through basically 2 points of entry. The entry point, that's the pink one on the upper pink one, you can hit the lower eyelid tear trough, anterior cheek, canine fossa, buccal zone, all from 1 stick, and it's an 18-gauge stab incision, not no core, just standard. And then when I'm focusing on the pre-jowl and anterior chin, it's from another stick, so, and it's again medial to lateral. So you can access everything through 2 sticks. This is in your handout, so you don't have to try to draw this. This is the lady on the left before she had the Vitrace, and again, I didn't do that. She's got little Tyndall effects near the nose, and the one on the left lower eyelid, I dissolved it on the middle, and then I came back and filled all the areas, including the buccal area, using the technique you just saw, and this is the lady you saw in the video. There's a lady here, so let's go through some aesthetic ideas. What would this lady benefit from most? I did do a little bit of Restylane on the lips, but other than that, everything else is volume-based. It's a cc of Restylane under each eye, a cc of half cc of Restylane to the cheek, and also half into the buccal zone. And then for her, she's got a little mini jowl, so I worked a little bit in the jowl and a little bit into the bone depression so that I can get that upside down U we talked about in the video improved. And this is a lady here that's a cc aside. Actually, you know what, I don't think I did that. I think I did a half a cc of Restylane per tear trough where the maximal depression is. And then I did a half cc, so in other words, I didn't do the whole over rim. I just targeted the tear trough with Restylane. And then I did an anterior cheek fill with the Perlane we talked about and a little buccal fill with Perlane. And then for her, she's bonier than she is jowly. So I hit almost the entire Perlane into the anterior chin to create a better blending effect across that jawline. Because I think a lot of times we're very focused on the positive problems around the chin, which are the saggy jowl and the labiomandibular crease, but it's the anterior chin depression that I really find that ages someone. Your 35-year-old lady here, this is a cc aside of Restylane per under the eye. This is a anterior cheek fill, no buccal fill, and a primarily almost entirely into the anterior chin with really no pre-jowl since she really doesn't have much of a jowl to manage. This is a lady that she works with me, and you can see she's got relatively larger lower cheek. So my goal was actually to work around the cheek and to blend it in by relative size by increasing the upper cheek so that the cheek just doesn't look so full. And this is that something you can do with optical illusion, is just blending the face, almost like airbrush work, to create a more seamless face. And this is almost all anterior chin work as well. This is a 29-year-old lady, so I'm rejuvenating someone under 30. But it's really facial balance. So it's a cc under each eye. It's a half a cc of Perlane onto each cheek, half a cc of Perlane into each buccal area. And then for her, again, she's not heavy, so everything has gone into the anterior chin to create that padding. Most of these photographs are taken about a week out. This is a lady here this is actually Juvederm, because she's actually the Allergan rep. So I just did it for free for her, and it's a cc of Juvederm under each eye. It's half a cc of Juvederm Ultra Plus into the cheeks, and also again, this is an anterior chin push because she's a younger lady that doesn't need any jowl fixing. This is a lady that if you look at her through the classic problem, she's got significant lines, but I actually didn't manage any of the lines. All of this is volume. It's cc of Restylane under each eye, the anterior cheek, and a little bit of buccal transition again. And then again, this is more of an anterior chin issue because she's bonier than she is jowly. This is my nurse, and she has what I call sort of a parentheses nasolabial groove, and that is what I think this clown look that actually detracts from beauty and that I attacked with some Restylane. Actually, I did Perlane for her lines. So under eyes, anterior cheek, and again anterior chin. So just sort of seeing things in reverse, if you will. This lady was 2 weeks before reunion, so this is 7 syringes to get her looking as good as we can. And again, that has that sort of clownish nasolabial groove, and I filled that as well. So it's under eyes, anterior cheek, buccal transitions, anterior chin with a little extra into the jowl, pre-jowl area itself. The pre-jowl, if it's not clear, is the area anterior to the jowl to create a better transition. This is a 37-year-old lady. On the left, she just had her lips and lines done by another clinic, and then this is a week after my work using filling into the anterior cheek, lower eyelids, buccal transition, and anterior chin. And that just gives, I think, a more harmonious face. And she's actually over a year out, holding quite well. The lady that has a heavier face, and this is very little anterior chin work, a little bit, but a lot of it into the jowl itself, about 2/3 of that product into the in the pre-jowl to create a better blended look to her face, but also take some of the weight off her lower face. So thank you for your attention with that.